we have covered with two nursing theories in last lecture. First one was the Florence Nightingale's environmental theory, and after that we have also covered the Roy adaptation model, right? So today we are going to see two more theories. The first one is Orems self-care deficit theory, and second one is Virginia Henderson's uh, 14 points theories. Okay. So let me break down Dorothy Orem's theory to easy so that is easy to understand. Let's go to introduction. Dorothy Orem developed the self-care deficit nursing theory in 1971. This theory is also known as Orem's general theory for nursing. It is one of the most widely used grand theories in nursing practice. The theory focuses on patients' ability to perform self-care activities and define nursing role when individuals are unable to meet their own self-care needs. So Orem developed this theory in 1971. It is also called as general theory of nursing. It is one of the grand nursing theory. It is also called as grand nursing theory. And in this theory, it focuses on how the patient is able to do self-care activities and where and what are the activities, self-care activity he is unable to perform. To assess that self-care activities which the patient is unable to perform, and after that, while after assessing, when we find out which of the activity, self-care activity, patient is unable to perform or the individual is unable to perform, what can we as a nursing can do to help that patient or individual in taking that self-care or giving that self-care need to the patient. That is overall Orem's self-care deficit theory. This Orem theory is simply based on one simple idea, that is, people should be able to take care of themselves. But when the people are unable to take care of themselves, at that time, nursing comes in the light. Nursing do all that care or give all that care to the patient which is needed for the self-care of the patient. Okay. Next, we will see what are the different key concepts. Now, in Florence Nightingale theory as well as the Roy adaptation model, we have seen what are the major key concepts. In Florence Nightingale theory, there were three, such as individual, means people, environment, and the nurses. Here also we have three things, that is self-care, second is self-care deficit, and third is nursing agency. These are the three parts of the theory. Okay, so let's see first part, that is self-care. So self-care refers to the voluntary action performed by the individual to maintain life, health, and well-being. It includes activity that mature and maturing person perform for themselves when they are capable. Means all the activities which we do for taking care of self. This all activities which we do to take care of self, to maintain our health and life, is called self-care. And the mature person or person who are maturing, who are capable of doing such activities, such as we do our daily routine activity like brushing, bathing, doing exercise, eating, taking medicine on time. A healthy person will take self-care to maintain his maintain his well-being and health. That is self-care. Second concept is self-care deficit. A self-care deficit word itself means when a person is unable to do all these self-care activities such as bathing, eating own food, or doing exercise. At that time, self-care deficit arise. Okay, a self-care deficit occurs when an individual self-care demand exceeds their self-care agency ability. This creates a need of nursing intervention. When we are seeing that the patient is or the person, individual, is unable to do self-care activities such as eating the food or doing movements or bathing, when the person is unable to do all these things, nursing intervention takes place there. When we see the patient is unable to do bathing or brushing the teeth also, so what we do? We do the care. We give bed bath to the patient, we give oral care to the patient, we can give hair care to the patient, right? So this is the self-care concept. self-care deficit concept. Third one is nursing agency, the specialized ability of nurse to assess, plan, and implement care to meet the patient's therapeutic self-care demands. So, nurse, what is the nursing role here? We assess how much the patient is able to take care and what are the deficiencies, what are the self-care deficiency seen in the patient. We are going to assess this. After assessment, when we know where is the problem, for that problem, we are going to plan the intervention. Suppose the patient is unable to take bath or unable to have his own food or unable to do movements on his own. So what we are going to plan? We are going to give bed bath or sponging to the patient. We will helping having the food to the patient, as well as if he or she is unable to do movements on his own. So at that time, what we can do, we can change the position time to time of the patient. So these are the implemented care we are doing. For what purpose we are doing? So whatever these self-care demands of their or the patient is there, we will be fulfilled by the nursing. Now this nursing, what we say, nursing care is in three, can be provided in three manner. When the patient is uh, completely dependent on us, patient is partially dependent on us, or patient only needs supportive education. So first one is wholly dependent. When the patient is wholly dependent, when he is unable to do any movement, in cases of paralysis or in the cases of what we say unconsciousness, RTA patient, or the patient is in ICU and everything is restricted to the patient. When the patient is totally bedridden, at that time, nursing care is complete nursing care. Overall, self-care needs or demands are fulfilled by the nursing staff, right? Second is partially. In partially, what happens? Patient requires some help of the nurse. In some activity patient can do on his own, but some self-care activities require assistance or help. At that time, that kind of help is partial help. And third one is the patient is able to take self-care, but education is required, such as, for example, in diabetes patient has recently came to know that that the person is having diabetes and patient is on insulin. Okay, insulin inject insulin. Patient is on insulin. So what happens? In the beginning, the patient won't be able to take insulin on his own. Starting in the hospital, when he is admitted, nurse will administer. But after going home, who is going to do that work? So at that time, we require to teach to the patient how to take insulin, where to take insulin, how to insert the injection, how much amount of the insulin should be taken, when the insulin should be taken. This overall education is going to be provided by nurses to the patient for taking the self-care at home. So this is supportive educative care. Okay. Next, we will move to three interrelated theory. So this theories is again interrelated to three theories in itself. Okay. So first theory is theory of self-care. So what does theory of self-care says? This theory describes why and how people care for themselves. So in general, in daily life, how everyone take care of themselves, it shows us that self-care action performed to mental health. So what are the self-care activities we perform to maintain health? Do you have any idea?
Self-care action
Yes, we
to
daily
maintain
do to
from
maintain health.
exercises and yoga and to prepare herself and mentally and physically and to understand their
Okay.
health condition
Yes.
like that, I
Right.
guess.
So daily self-care activity, what it is, we have food, water, time to time, take proper air, then elimination pattern also, maintain activity, rest, both time to time. Then balance between staying in a group, then staying alone, prevention of hazards. This all comes under self-care action performed to maintain health. To maintain health, this all daily routine activity do, self-care activities we do. Second is self-care repositories, needs that must be met. So Self-care requisitory is when during the developmental stage. Okay, when the person is developing at that time, some are the demands to be fulfilled in that age or at that time only. So, for example, here I can give of pregnancy. During pregnancy, there are demands increases related demand changes also and increases also for that 9 months of period, right? And same goes for different age group, means infant, adolescent, teenage. As per the requisitories must be met at that time of the age. Third one is therapeutic self-care demand. Total self-care action needed. So here the therapeutic self-care demand or action is when the patient is admitted or patient is not well, he is ill. So at that time when the treatment is given to the patient or when the patient is adapting to that particular illness, that comes under therapeutic self-care demands. Okay, self-care demand for the well-being when the patient is ill to getting well, whatever the treatment he is getting for himself, that is the therapeutic self-care demand. Okay, next is
Mm.
theory of self-care deficit. This theory describes when nursing is needed, nursing is required when individual cannot meet their self-care demands, that we know there is a gap between self-care ability and self-care need. The person requires assistance to maintain health. So what is theory of self-care deficit says us that when the patient is unable to do his own self-care activities, that may be during illness or due to some disease condition. Okay, there is a gap between self-care ability and self-care needs. Means what, how much activity the person can do, but that much activity is not sufficient to meet all the self-care need. Some activities may be required to be done by others or the helping person. The person require assistance to maintain health. And in theory of self-care deficit, third point says that when the person requires to maintain assistance, help of other person to maintain their health, that all things comes under theory of self-care deficit. Okay. Third one is theory of nursing system. This theory describes how nurses help patient. It defines the relationship and role between nurse and patient. So last theory is very common or daily we do. If as a nurse or the nurse in a hospital who is working in a hospital, she knows because how she is helping to move a patient by moving a patient by giving proper diet to the patient or whatever the daily routine self-care activities are there, bathing, sponging, oral care, back care, bed, providing proper bed. If this all this theory describe how we as a nurse helps the patient in taking self-care. Okay, means it defines how is our relation to the patient and what is our role in taking care of the patient. Okay, so these are some self-care repository and these were given by Orems. And what uh, she has found that these are the need to be met. Okay, so self-care repositories are the reason for which self-care is undertaken. Orem identify three types. So as per there are three types of self-care repositories. First is universal. Universal means each and every individual on this planet require this self-care. So first one is these are common to all human beings and include maintenance of sufficient intake of air, water and food. That is common. Everyone requires proper air, water and food to maintain their health. Next is provision of care associated with elimination process. This is also right. If one of the day stool is not passed or urine passage is not there, what happens? The person will feel uncomfortable. So provision of care associated with elimination process. Maintenance of balance between activity and rest. Continuously activity will also don't work, and continuous rest will also affect the health of patient. So there should be balance between activity and rest. Maintenance of balance between solitude and social interaction means there should be balance. Continuously we can't be in a group. Sometimes we require what we say some alone time, uh, mm, what we say space to think or to relax. Okay. Next is prevention of hazards to human life and well-being. So we healthcare all can also be taken. How? If we are preventing ourselves from any kind of accidents. Okay, if we are not preventing it and we met with some accident, what will happen? We will be ill. That will hamper our health, right or not? And last is
Yeah.
promotion of human functioning and development within social groups. So when we will promote our functioning and our development within the social group, these are the universal self-care repositories. First, in the three type, first type is universal self-care repositories, which is common in overall world to each and every individual. Okay. Next is developmental self-care repositories. So these developmental self-care repositories are required where the stage of development is taking place. Okay. These are associated with development, human development, and include care need during different life stage. So I have told in first second slide, last to last slide, that as per the age group, infancy, toddler, childhood, preschooler, schooler,
Mm.
every age group has different kinds of requirement, self-care requirement, and that should be fulfilled at that stage only. So care needs during different lifestyle is different. Adolescent requires self-care time or what we say, personal time.
Alan?
Okay. In pregnancy, what is required? There is increase in nutrition, proper exercise, relaxation. There is increase in the food intake. And during aging, what happens? That also alters. The diet is reduced, relaxation time is increased. Okay. Uh, more activities cannot be done by aged person. Last is condition can adversely affect the development. So some condition may affect this development during infancy or childhood if someone has met with the accident or the or things which have hampered their development. So this self-care repositories are required at particular developmental age to smoothly running of that developmental stage in that particular age group. Okay. Next,
Yeah.
third self-care repositories is health deviation self-care repositories. So third point we have a in see in last to last slide that when the person is ill or and during that illness when he is taking that treatment. Okay. Health deviation self-care repositories means where self-care required during the health mm, health when the person is not well. At that time, which are the requisitories or requirement of the person? These arise from illnesses, injury, or disease and include seeking and securing appropriate medical assistance. First, we require what? We require assistance in knowing that what kind of disease I'm suffering from or the person is suffering from and where to take treatment or to meet which doctor, which specialized doctor I should go and talk about this condition. First is that seeking and securing appropriate medical assistance. Second is being aware of attending to disease effects means I should also know what kind of disease I am having and what may be the side effect or effect of that disease condition on overall health of me. Third one is carrying out prescribed diagnostic and therapeutic measures for confirmation of diagnosis or condition. We have to the person has to do what? Do proper test or the test which has been what we say prescribed by the doctor, that should be completed for confirmation of the diagnosis, or for confirming what kind of treatment should be given for that particular disease. Being aware of and regulating uncomfortable effects of treatment. The person should be aware of what kind of treatment he is going to get and what is the effect of that treatment on the uncomfortable effect of that treatment on the body of the person. Next is modifying self-concept to accept being in a particular state of health. We have to change what is the self-image of the person. We have to make him understand that this person, the individual, he should accept himself, even if this disease condition is affecting him or changing. There is it is making some changes in his physical appearance or internal also. At that time also, he has to accept himself and carry on with his daily activities or with his life. Last is learning to live with the effects of disease and treatment. When we will modify the self-concept of accepting being, when the person will able to accept himself, at that time what we will do, we will make him to learn to live with his condition and the effect of the treatment. Okay. Next
Hmm.
is nursing
Please continue.
system. Orems identify three nursing system based on the patient self-care ability. So I have talked about this in starting only. In the nursing system, I had told you the nursing care. When the nurses provide self-care, it is divided into three main parts: wholly, partially, or only adequative type. So what is wholly compensatory system? When it is used, patient is completely dependent and unable to perform any self-care activities. Wholly compensatory system, when the patient's completely system is compensated. He is completely dependent on another person for his self-care. Understood? His role perform all the care for the patient. Examples for that it is given: unconscious or coma patient, patient undergoing anesthesia, patient in acute critical condition, paralyzed patient with complete dependence. Now these example are all of the patient who won't be take who won't be able to take their self care, right? They require someone else to take, and who is going to take care here? Nursing paper people are going to take care of overall self care requirement of the patient. Okay. Second, compensatory system, when patient performs some activity but not all self-care activities. Nurse's role, what is the nurse's role here? Assist the patient by performing the task the patient cannot do, while allowing the patient to perform activities they are capable of doing. So simple is, when the patient is able to do some activities, let him do that activities on his own. But which activity he is unable to do at that time, nurses can help in or perform that activities for him or her. Example for post-operative patient recovering from stroke with partial paralysis, patient with limited mobility in what we say RTA patient, or the recently who has gone through surgery, or the fractured patient, or patient with after the amputation. So such patient can perform some activities. Let them perform that activities, and which activities they are unable to perform in that activities can be performed by us for them, or we can assist in that activities. Okay. Last is supportive educative or educative developmental system. When used, when the patient is capable of performing self-care but requires guidance, teaching, or emotional support. When here the patient physically can do all these self-care activities, but sometimes they require guidance or education regarding that activities or how to perform them. When due to illness or the but whatever the incidents has happened with them has changed something physically in them. So for that, getting back to the routine requires some help. So that guidance and support will be provided by us to them. So nurses' role is to provide, teach, guide, teaching, guidance, and psychological support. Example in which patient it requires is newly diagnosed diabetic patient learning insulin administration, patient learning about lifestyle modification, amputized patient especially, how to live with that amputate area of body part, how to have recently lost his eyesight, so how can he utilize other senses, and how he can learn new things by or the sign language and all kind of. Patient requiring health education about diet and exercise. So due to some conditions, suppose hypertension, patient has recently got hypertension or diabetes also, so what new modification they need to require do in their diet or about the exercise, so that their health can be maintained. And lastly is mothers learning newborn care. So recently, or the one who has been first time become mother, so she also requires some help with the changes related to her body, as well as how she can be able to take care of her new ones. Okay, move toward next, that is nursing process and Orems theory. How we have to apply this theory in nursing process. Okay, so in assessment, where we can apply this theory when the patient is unable to take self-care. The diagnosis which you are going to write is related to self-care deficiency. Okay. So as in assessment, what you are going to do, determine the patient's self-care ability, identify where the self-care deficit, what are the area of self-care deficit, and assess the therapeutic self-care demands. So what are the self-care demands of the patient? We have to assess all these three things in that patient during the assessment. Okay. So when you are going to write assessment or in nursing process, so you have to assess the area or the patient self-care area where he is unable to perform that self-care activities. What are the self-care deficiency which need to be fulfilled in the patient? You have to identify it. And third one, assessment of therapeutic self-care demand related to treatment. What are the self-care demand required by the patient? In the assessment, you have to do these three things. Next is diagnosis. In diagnosis, identify specific self-care deficits. What we are going to find that specific, we have to specify where the self-care deficit. We have to identify what is the self-care deficit areas in the diagnosis. We have to specify that particular single area. Determine the appropriate nursing care system. So when we identified that self-care deficit area, what nursing care is required? Is it wholly compensatory, partially compensatory, or third one is educative? We have to determine. Here the complete care will be provided by nurse, partial care will be provided, or only educative or supportive care will be provided. We have to determine it. Third one, in planning, design nursing intervention to meet self-care deficits. So in nursing care plan, we write down interventions, right? Planning we do. So what we are going to do for the patient to meet the self-care demands. You have to plan the intervention in that manner for meeting the self-care deficit area of the patient. Set goals for promoting independence. We have to set such goals that this self-care which is provided to the patient will fulfill his future needs and help him or her to perform this activity on his own when he will be able to do these activities. Okay. Next, in implementation, apply the appropriate nursing care system, assist with or perform self-care activities. In implementation, what we are going to do, we apply appropriate nursing system with that we have seen completely, partially, or educative. What depend upon the self-care deficit area. Okay. In
Yes,
implementation,
yes,
whatever the planning we have done in intervention, we are going to implement on the patient. Okay. We can uh, provide directly the self-care activities, or we can provide education on that activities so that he can perform that activities on his own in the future. Last is evaluation. Assess achievement of self-care goals. We have to see whatever the goals we have planned so that the patient in future will take do his self-care activities on his own are achieved or not. We have to assess that, determine if patient has gained independence, and modify plan as needed if the self-care activities which we have planned has not met with the goals. Whatever the goal we have, that the within few days the patient will be able to do this activity on his own, but if the patient is unable to do that during that time period, so we have to change again some points in the intervention, or we have to plan another intervention to meet our planned goal for the patient. Okay. Next, we will see is role of nurse. According to Orem theory, the nurse's role include acting or doing for others when they are unable, guiding and directing patient in self-care activities, providing physical and psychological support, providing and maintaining an environment that supports personal development, teaching patient to meet their self-care needs, promoting patient independence and self-care abilities. So according to Oram theory, what is nurse's role is, first, we have to act or we have to do care activities for the person who is unable to do themselves for their own. Second is guiding and directing. When the patient is able to take care, but he require guidance, so we are going to give guidance to the patient so that he can do self-care activity on his own. Third one is providing physical and psychological support. If patient has met with an accident and he is in anxiety now, so we have to provide psychological support in that condition, and physically also when the patient has met through an accident and there was some fractured limb or some what we say amputate limb, so at that time how to do physical movement with that type of condition, we are going to provide support in that. Okay. Next, fourth one is providing and maintaining an environment that supports personal development. We have to provide such environments so that the patient will be encouraged in doing these activities. He will develop self-care activity, do self-care activity on his own. We have to provide such environment to the person. Next is teaching patient to meet their self-care needs. How we have to explain and teach them how they are going to perform this activity when will be discharged from the hospital, and at home how they are going to do these activities. And next is promoting patient independence and self-care capability. We have to promote when the patient is trying to do some activity on his own, we have to promote such kind of activity and increase the patient self-care capabilities. Okay. The advantages of this theory. First advantage is promote in patient's independence and autonomy. Means when we support patient when he is doing activity, we encourage him. So what it will do, it will promote independence. Means patient can do his activity on his own. He can take responsibility of his own. That activity, self-care activities, applicable across all age group and healthcare setting. This theory can be applied in every age group as well as all type of healthcare settings. This theory can be applied. Provides clear framework for nursing practice. We have proper guidance for this practice, what we can do for patient, what we can assess. We can assess the self-care deficit area. We can plan for particular self-care deficit area, plan interventions, set goals, and we have to apply that. And after that, we have to again assess that our goals are met or not. So it is easy and the clear framework is available with us for Oren's theory. Focuses on holistic care. So it focuses on overall care of the patient, overall health of the patient. Encourage patient participation in care. When the patient is trying to perform his activities or trying to do all his activity on his own, we should encourage the patient. So he will be capable of doing this activity on his own afterwards. Last is guides nursing education and research. It will help us to do our nursing research. means if we are doing research in which what are the activities we can do to encourage patient to do self-care activities on his own, we can do research on this, and this help us, this theory will guide us in doing such kind of research. So in research we apply theory. So if there our research include related something related to self-care abilities or capabilities of ill patient, or suppose fractured patient. So in that kind of theory, we can apply that type of research. We can apply this theory, Oren's theory. Okay. Now, what is the limitation of this theory? The first limitation is complex terminology may be difficult to understand, may not be suitable for a patient who cannot participate in self-care. Cultural variation in self-care practice are not fully addressed. Focuses more on physical aspect than psychological aspect. So this is true. Many of the time, what happens, terminologies or the conditions are unable to understand by the patient. Okay. Next, or terminologies also, or the activities also. Suppose taking insulin is not, means everyone's cup of tea. Means the patient, everyone will not be that what we say capable of taking syringe and injecting to himself or herself. Okay, so it can be complex for some time, may not be suitable for patient who cannot participate in self-care. So this theory is will not be suitable for such patient who cannot perform his self-care activities at all, such as coma patient. Okay, we never know that the patient is going to be again he's going to become conscious or not. So this theory cannot be applied in that condition, or cannot be suitable in that condition when the patient's participation is none. Okay. Third one is cultural variation. So cultural variation may occur. Some people may not allow to provide bed bath or sponging also by another person other than family person. So here the cultural variation may also cannot be is fully addressed while using this theory. And last is focus is more on physical aspect. So yes, we have seen here self-care deficit majority comes on the activities related to physical activities. It may be walking, eating, rest, sleep, or bathing, right? So these are more focus. This theory more focused on what, that is the physical aspect, not the psychological aspect. So these are some limitation of this Orems theory. Okay. So I'm moving toward next. That is the conclusion. Conclusion says that this theory completely have a framework what we do in nursing practice, that is meeting the individual need, self-care needs, whatever the self-care needs is that it focuses on that. And it's also apply in nursing system in three ways: whole, partial, or educative. Based on the patient need, we have to select, does the patient require complete care, partial care, or only educative care. And according to that, we have to give the self care and improve the health outcome of the patient. As well as this theory can be relevant in modern nursing also, and we this theory guide the nurses in providing patient-centered care. Here the focus is on whom? The patient. How the demands of the patient, self-care demand of the patient will be fulfilled. So this is here is the focus of Orems theory. Virginia Henderson's theory. You must have heard her name. Virginia is the one who has given definition of nursing, which we
Mm.
use, which is given in Sister Nancy. Daily mismed. Majority of us know her. Introduction. Virginia Henderson in 1897 to 1996. She was an American nurse, researcher, and author known as First Lady of Nursing. She developed the need theory or basic needs theory in 1955. in which has become one of the fundamental nursing theories globally. Her definition of nursing emphasizes the nurse's role in assisting individuals to achieve independence in meeting their basic needs. So it is also called as need theory or Henderson's theory or 14 basic needs theory. So here this Virginia Henderson's, she focuses on what are the 14 basic things, needs of the patient, and that how a nurse can cover up or give that kind of care to the patient, how we are going to meet that basic needs of the patient. This 14 basic needs theory cover ups that. Okay, toward the definition which is given by her to the nursing. So you have may you have heard this definition. The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge. And to do this in a such a way as to help him gain independence as rapidly as possible. So what does this definition says us? So what is the unique function of what is the function of nurse? It is to assist the person who is not well. Okay, we have to assist the person who is not well in performing those activities which he must have performed when he was well or he was able to do that kind of activity. But due to illness, he is unable to perform that activity. For that purpose, we are going to perform that activities for him. For what purpose? So that he will heal as rapidly as possible. This definition highlights three key components, that is, assisting patient in activities they cannot perform independently. Second is promoting health restoration of peaceful death. Third one is facilitating patients' independence. So first, what this definition wants to say, we have to assist the patient in activities which they cannot perform on their own. Second is promotion of health or restoration of health or helping the patient in having peaceful death. That is the second. And third one is facilitating patients' independence. Means when the patient is recovering, helping him to gain that independence in performing the activities. Okay.
Okay. Facilitate the patient independence. Okay.
So main goal of nursing, according to Henderson, is that the patient should gain all the independence as soon as possible so they can take care of themselves when they leave the hospital. That is the main of this Henderson's theory. Is it clear? Next, we will see what are the 14 basic human needs. We have seen her theory states that there are 14 basic human needs. So what are that 14 basic human needs? Henderson's identified 14 fundamental needs that are essential for human functioning. These needs form the framework for nursing assessment and intervention. So these needs, which are the 14 fundamental needs, from that we can develop the framework what we should assess in the patient, what need should be assessed in the patient, and what planning we can do for such kind of efficiencies or the needs. First, physiological needs. So 1 to 9 are the physiological needs. First one is breathe normally, adequate oxygenation and respiratory function. Second is eat, drink adequately, proper nutrition and hydration. Third one is eliminate body waste, normal elimination through bowel and bladder. Fourth is move and maintain desirable posture, mobility, and proper body mechanics. Next is sleep and rest, adequate sleep pattern and rest period. Sixth is select suitable clothes and undress appropriate clothing choice. Seventh is maintain body temperature, thermoregulation within the range. Eighth, keep body clean and well groomed, personal hygiene maintenance. And ninth is avoid danger in environment, safety and injury prevention. So these are first nine physiological needs of the body. Okay. Next, 10 to 14 are the psychological needs. These fives are the psychological needs. First one is communicate with others, express emotion, needs, and feelings. Next is worship according to one's faith, spiritual practice and belief. Whatever the patients believe or whatever the devotion he is following, let him follow that and worship according to it. Next is work in a way that provides accomplishment, productive activity. Means the person should be involved in such activities which will give something to them. Means mental satisfaction should be there while performing such kind of activities. Okay, work, such kind of work. Next is play or participate in recreation, leisure and recreational activities. Completely being immersed in work would provide with happiness. We have to have some own time in that we can have some activities or recreational activities which will help us to think more nicely or more clearly. Okay. Last is 14, that is learn, discover, or satisfy curiosity, educational and developmental needs. So these are the 14 basic human needs that each and every individual requires. So when the patient is not well, we have to assess from these 14 which are the needs are not fulfilled or the patient is unable to complete these needs, and what we can do to complete these basic needs in the patient. Okay, while assessment we have to assess which are the basic needs which is not fulfilled. Is it the patient is unable to take proper breath, or the nutrition, there is dehydration in patient, or there is weight loss or excessive weight gain in patient, or patient is unable to pass stool or urine, or due to accident patient is unable to move his body properly, or there is problem in the posture of the patient is not taking proper sleep, or patient is complete always sleeping. We have to assess what are the as if the patient is admitted from this 14 need, what are the need patient is unable to achieve, and when he is deficient in achieving the such needs, what we can do to achieve, make him achieve that needs, what intervention we can plan to achieve these needs for him. Okay, we have to, what are the major concept in Henderson's theory? First one is person. Who is the person here? A holistic being with 14 basic needs who require assistance to achieve health and independence or peaceful death. So the person with these 14 basic needs who require assistance to achieve health and independence or peaceful death. When this 14 basic needs, is from that basic needs, if something is unfulfilled, we have to assist the person in achieving proper health by completing that basic needs and providing him independence in performing that basic need or fulfilling that basic needs, or having a peaceful death. Second is environment, that is all external condition and influences affecting life and development which the nurse must modify to promote health. So many times happen our external environment is affecting our basic needs. Maybe our basic needs are not fulfilled or not getting completed due to external environment. If such external environment is in our hand, if we can change it, so as a nurse we should change or modify that environment so that patient's health will be promoted. Third one is the health quality of life essential for functioning, defined as the ability to function independent in relation to the basic 14 basic need. So what is health? We have seen definition of health. So here the health means when this all 14 basic needs if the
Oh,
patient is
wow.
able to perform all that 14 basic need, or his all 14 basic need is fulfilled, that is health here. Okay, in this theory. And fourth one is nursing, assist individual sick or well. We can assist well people also if they are unable to perform some of these basic need. Okay. Contributing to health that they would perform independently if they had strength, will, or knowledge. So, nursing here will assist the individual in performing those activity so that their health will improve, and till them till that they will on their own perform these activities. Okay, if they have proper knowledge, will, or strength to perform that activities. This is nursing concept in Henderson's theory. Is it clear? Role of nurses. According to Henderson, the nurses function in three capacities. First is substitute for patient, helper to the patient, and partner with the patient. Substitute when patient is completely dependent. Substitute means what? When we are replacing someone, right? So here, according to
Yeah,
Henderson, nurses function in three capacity. First one is a substitute to the patient. Substitute for the patient. When patient is unable to perform that activity for his own, at that time, nurse will perform that complete activities for the patient. Second is helper. When the patient is able to perform some activities, but some he is unable, at that time, we will perform that activities for him. Third one is partner with the patient when the patient requires knowledge and strength. Similar to the Orems theory, when there is nurses help in three manner: wholly, whole compensatory, partial compensatory, or educatively. So here, wholly when substitute for the patient, helper when the partially help is required, and partner with patient when the patient requires knowledge or strength or will, when we support him to perform the activities. So the ultimate goal is always to make the patient independent as quickly as possible. So in this, main role of the nurse is to provide, the main goal of the nurse here is to make the patient independent as quickly as possible so that he can perform all the activities of 14 basic needs on his own. Okay. So we will see application of this theory in nursing practice. Henderson's theory provide a practical framework for assessment, planning, implementation, and evaluation. Again, how we can apply this theory in nursing process. First, evaluating which of the 14 needs are unmet or inadequately met. First, we have to see what are the basic needs which are not fulfilled in the patient, or which are incompletely fulfilled in the patient. Okay, that will come under assessment. In planning, developing care plan addressing this deficit needs. So when the suppose your patient is unable to breathe properly, okay, so you will write nursing diagnosis that it will be ineffective breathing pattern of the patient related to whatsoever it is. So this is the assessment. In that assessment, what you find out, that from 14 basic need, the first need, that is breathing, the patient is unable to breathe properly, that is unfulfilled or partially fulfilled, right? So how this was your assessment, this will go in diagnosis. Then next is planning for that unfulfilled basic need of breathing. What you are going to plan, how you are going to make patient breathe effectively, that you have to plan. That for that you have to plan intervention. Next is implementation, providing assistance according to patient's level of dependence. So we have to plan intervention so that the patients will be able to breathe effectively, and that planning we have to implement. And in implementation, what we are going to do, we are going to assess the patient as per his need. How much level of assistance is required, at that much level of assistance we are going to give. It may be substitute, it may be what we say helper, or it may be supportive. Okay, in this three manner As per the requirement, level of dependence of the patient, we will provide the assistance in the implementation phase. And lastly is evaluation. We will measure the progress toward independence in meeting the basic need. We will see how much the basic need of that particular area which was unmet or partially met is completely fulfilled or not. And if it is not, we will again replan for the patient. Okay. Next is significance and contribution of this theories provides a clear universal definition of nursing practice. So we use this definition everywhere, or this definition is common everywhere, because what is the main work of nurse? It is to help or assist the patient who is sick or well in performing those activities which is unable to perform on his own, or which he can perform on his own when he is well or able to perform that activities, right? So it provides us a clear and universal definition for nursing practice, emphasize patient independence and holistic care. So where the focus of this theory is that the patient will develop his own capability in performing these basic need care activities. Third, applicable across all clinical setting and patients population. So it is applied to each and every patient or clinical setting area which we can utilize this Henderson's theory. Fourth one is forms a basis for many nursing curricular worldwide. So this gives us the basis. So whatever the nursing care plan we are having, majority of the basics are from this Henderson series. What are the 14 basic needs? No, that covers majority of the nursing curricula, and it is covering worldwide. In overall world, we can utilize this curricula of nursing everywhere. Next is influence the International Council of Nurse definition of nursing. So this Anderson's definition has influenced the whom International Council of Nurses for the definition of nursing. Okay. So next is what are the limitation of this cell? Does not clearly explain the relationship between the 14 needs. So we don't understand what are the relation of each and every needs, basic need in this theory. Next is limited guidance for complex and chronic conditions. So some conditions are very chronic. At that time, how we can fulfill this all 14 basic needs, it is tough, because some condition there will be that particular sign and symptom which cannot be what we say, which cannot be eliminated from the patient. It is going to be there with the patient throughout the process or throughout his life, which cannot be fulfilled. At that time, what we can do, this theory does not explain that. May be considered too simplistic for advanced nursing practice. For advanced nursing practices, we cannot consider this theory because it is too much simple. And yes, it is too much simple because it has stated that 14 basic needs, and we have only that means 14 points which we can look after if we are using this theory. It is too much simple. And nowadays disease have too many complexity, due to which too many complex things or complex care needed to be given to the patient as per the disease. Okay. So advanced nursing practice may not consider this theory for fulfilling patient's need, does not adequately address family and community nursing. So here main focus is overall on patient or the individual. It does not addresses family needs or community nursing needs. Okay. Lastly is conclusion of this theory, and that's so this theory is one of the most used and influential theory, means it has influenced each and every one in the nursing practice, and it provide means care related to patient centered care in as per the theory, and it focuses on what that the we should provide such type of care that all 14 basic needs of the patient are fulfilled, as well as he will be able to perform those activities of self care on his own, is the focus of this theory. And this theory is such so simple that it can be used and practically can be applied in each and every healthcare settings, and it provides us base for nursing practice and education. Okay, is the conclusion clear?
No, I'm just looking in this conclusion.
Okay.
I hope you all have understood both of this theory. If there is any doubt, you can ask questions.